Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Rohini Soni is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS, MD, and is specialized in dermatology, cosmetology, and trichology. She currently practicing as consultant dermatologist at KVR Hospital, Kashipur. Dr. Rohini has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to her patient. She take time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Rohini is also aware of the need for the patient education about hair and skincare and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your questions on
Hello.
hair care for us today. Welcome to this YouTube live show.
Thank you for having me here, and I'm very thankful to IPCA for conducting such a good webinar about current hair scenario.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया सो टुडे वी आर गोइंग टू टॉक अबाउट हेयर केयर इन करंट सिनेरियो एंड whenever we talk about hair care in current scenario, apart from hair loss, another very common problem which is faced by all of us is dandruff. And people who have dandruff, they keep asking themselves कि ये क्या हो रहा है, ये क्यों हो रहा है, what is this, and can we cure this dandruff by using these anti-dandruff shampoos?
Uh, in few cases, when the case of when in few cases the dandruff is at the lower level or the mild seborrheic dermatitis, then it can be treated with the anti-dandruff shampoo because it has ketoconazole, it has other components which can help in decreasing the fungal levels on the scalp. But when the case is severe or moderate, it cannot be treated only with the antifungal shampoos. Few other treatment options has also to be considered along with that.
Okay, that's very interesting, doctor. So, doctor, जब भी डैंड्रफ या फिर हेयर लॉस की बात होती है तो होम रेमेडीज इज लाइक समथिंग जो हर मदर या फिर ग्रैंड मदर प्रिस्क्राइब कर देती है कि ये लगा लो वो लगा लो सो कैन होम रेमेडी सच एज कर्ड can if we apply on scalp can they treat dandruff?
Actually, curd has lactic acid. So lactic acid, what it gives, it has a hydrating effect on the scalp. So curd will help in having a good shiny scalp or shiny hair, but it will not treat the dandruff for the completely. For the time being, it may be less, but it cannot be completely cured by using only curd. Few other things has to be applied. Actually it is fungus, so antifungal has to be applied for that.
Okay, that's very interesting. So, doctor, people with dandruff, they always like feel like कि बाल मतलब scratching करते हैं and then they feel irritated and उसके वजह से they see that there is some kind of hair fall also. So, with your profound experience, can you please enlighten us today? Can dandruff cause hair loss?
Yes, excessive dandruff can cause hair loss because excessive flaking, there is irritation, there is inflammation over the scalp, and due to that inflammation, hair fall can be there, hair loss can be there. And if it is not treated well on time, it can lead to a lot of hair shedding. So it has to be treated well. It has to be taken care of. And if it is not cured with only anti-dandruff shampoo, so a person should contact a certified doctor to treat that. So I think it works, but uh, all that treatment has to be taken.
Okay. So treatment is must if you have a dandruff instead of waiting for longer to start having your hair fall. So, doctor, whenever people have dandruff and people who don't have dandruff, they keep thinking कि इसका towel या इसकी चीजें use करेंगे तो मुझे dandruff हो जाएगा, या फिर even like if parents have, then the kids are always like कि मुझे ना हो जाए. Like, does it pass from family members or is it communicable? So, what's the fact behind this?
It is not severely infectious. It doesn't mean that if you sit next to the person having dandruff, you will catch dandruff. It is not like that. But
Mm-hmm.
if anyone is having a lot of fungal infection over the scalp, yes, it can spread from one person to the other person.
Mm-hmm.
But along with that, few people only have slight flaking, which is due to excessive shedding. It doesn't
Mm-hmm.
mean that they will pass that infection from one person to the other, because it is just excessive skin shedding. It will not pass. But if overlying infection of fungus or malassezia is there, yes, it will pass from one person.
Okay, okay. So it can on what is it genetic also? Like if the parents have, then does it can pass to the kids also?
Yes, if it can pass from one person to the other, so it is more likely na कि if you are living with that person using the same combs, using the same condition, you are not getting it cured, it will pass. Subsequently, it will pass to the other person as well.
Okay, okay. So doctor, apart from this, now that we know that what is dandruff and does it cause hair loss or not? So in this genre of so many information, there are so many different type of oils which claims that it can help treat dandruff or hair fall. So is hair fall help in treating dandruff?
In what I'm not understanding the question.
Is hair oil help in treating dandruff?
No, I don't think so. Apart from that, hair oils can increase the dandruff because oily environment further helps in growing of the fungus. Fungus need humidity and oil and sweat and heat and temperature for growth. So if we provide that, it will further increase that. Plus, oil can also increase the hair shedding because we use a lot of oil. We do a lot of pulling and pushing of the hair, which further increases the inflammation around. It also increases the hair dandruff as well as hair.
ओके सो डॉक्टर लाइक जब हम न्यूबॉर्न बेबीज को देखते हैं तो उनके सर पे एक अलग टाइप का डैंड्रफ दिखता है सो व्हाट इज दैट इज द डैंड्रफ और एंड इट इज इट ट्रीटेबल
Yes, it is treatable. It is not dandruff actually. It is just a इसको कहते हैं कि cradle cap because the secretions of the scalp coming from the scalp as well as skin which is not shed off completely forms a cap-like structure over the scalp. It is known as cradle cap. It can be easily treatable. Even anti shampoos such as ketoconazole is not required for that. Simple basic shampoos are required. It is easily gone.
ओके Okay, so doctor, people who have dandruff, they think that, and mostly people think that if I wash my hair every day, then the dandruff will wash out and it will go up quickly. So, what's the fact behind this?
If we start washing our hair every day, it will further it decreases the shine of the hair because the oil, the secretions, the sebaceous glands, the secretions of the skin also washes off with that. But it leads to the
Mm-hmm.
dryness and frizziness of the hair. So I think it is not the that we wash our hair every day and it's gone. It's just we are not seeing it. If we don't see it, it doesn't mean that we don't have it. We have the problem. It has to be treated with the proper care only.
Okay, okay. So it's nothing like कि रोज रोज बाल धोने से प्रॉब्लम ठीक हो जाएगी. It's always better to go to the doctor.
It will further increase hair fall, frizziness, dryness, and it will further increase the problem.
Okay. Okay. So, doctor, there are so many vitamins and mineral tablets. So, are they really helpful in treating dandruff?
Vitamins and minerals are very helpful in keeping the skin of the scalp well, but it cannot treat
Mhm.
dandruff. It will help in decreasing the hair shedding and hair fall if we have some vitamin
Mhm.
deficiencies or iron deficiencies. If we take the tablet, we obviously there is lesser hair fall. But
Mhm.
if the cause of the dandruff is some kind of infection, it cannot be that.
Okay. Okay. So vitamins and mineral can only correct the deficiency, but if there is some kind of infection, then we cannot cure it using only vitamins and dandruff. Vitamins and
We
minerals.
can
Okay.
give multivitamins along with the other medications, so that the because the patient coming to us usually says ki we have dandruff, we have a lot of hair. We give multivitamins along with that just to decrease the hair fall. But I don't think ki there is a direct role of anti so some kind of multivitamins over dandruff.
Okay. So doctor, like even there are so many hair mask also which claims that it can help in clearing dandruff. So what's like actually does it help?
Hair masks are usually giving it's applied over the length of the hair. It is not usually applied over the scalp of the hair, and it
Mm-hmm.
gives just a conditioning effect to the hair strands. That is, excessive dryness is gone after using some antifungal shampoo, because antifungal shampoo itself is a drying agent. It leads to the frizziness to the hair, gives frizziness to the hair. So we give hair masks along with that. We give post-wash moisturizing lotion even after using some anti-dandruff shampoo, so that it may not lead to the frizziness or excessive strands to be stand out from the scalp. But I don't think there is no direct role of any mask for treating dandruff.
Okay. So, doctor, there are so many like OTCs and medicated shampoos which contain like ketoconazole and ZPOT and moisturizer, which are frequently used for treating dandruff. So, what's your opinion on it? Like, are they really helpful?
Yes, they're very helpful when once they are used for the milder conditions. Because some people have
Mhm.
dandruff over a few months of the year. If they are not, it is not prevalent during the whole year. But if the case is moderate to severe, when it is not only getting relieved only by the ketoconazole shampoo, then other medications are added. Oral fluconazole has to be added in some cases. But
Mhm.
in milder cases, it works.
Mhm. Okay. So in milder cases, these shampoos can be helpful, but if you have a severe form of infection kind of, then we should go to the doctor and meet the
con- Contact period of shampoo is just 1 minute or 2 minutes, and
doctor.
anything which has lesser contact period cannot treat you completely. So leave-on
Okay.
solutions are also there, which are left overnight or for 8 hours. It works wonder when
Mm.
combined with some kind of antifungal shampoos.
Okay, very interesting, doctor. So, doctor, like people who have gray hair, they frequently wants to use hair dyeing because they also hide their gray hair. So, can hair dyeing also lead to dandruff?
I don't think so. There is a direct relation of hair dyeing and dandruff. Hair dyeing can lead to frizziness of the hair because the natural moisturizer is gone after using the hair dye. And if the people is using bleach, then color and luster of the hair is gone. But directly hair dyeing causing dandruff is, I don't think it is happening.
Okay. Okay. So, doctor, we've been talking about like infection, severe form of infection, and people usually don't like not able to differentiate between them. So, how to differentiate between a normal dandruff and a scalp fungal infection?
A normal dandruff and a scalp fungus infection.
Yeah.
Okay. A normal dandruff is just excessive shedding. It is not causing
Mhm.
much of irritation. It is not causing much hair loss. It is slight shedding, which is occurring either due to excessive skin turnover in few cases. Sometimes psoriasis is also the condition in which the skin turnover has increased. In that case, if the psoriasis is the thing which is causing the look-alike like dandruff, it is
Mhm.
also present in the other parts of the body, such as the extensors of the body, such as elbows, knees. Along with that, in
Mhm.
cases of psoriasis, it leads to further much more inflammation, and it is coming out of the scalp. It is not present on the scalp. It is coming somewhat extending towards the face as well, towards the
Mhm.
ear as well. But in
Mhm.
there is only slight dandruff, it is just
Mhm.
shedding, a few flakes are seen here and there. And when it is
Mhm.
fungal infection, it is very itchy, and it is very inflammatory as well, and it causes few flakes over the ears, around the nose as well.
Okay, okay. So if someone have like these kind of symptoms and it means it's not a normal dandruff, they should go to the doctor. Yeah, okay, that's interesting, doctor. So, doctor, like when like lifestyle is important for any kind of lifestyle related disorder. So, and in lifestyle, diet also play a very important role. So, diet play any role in managing dandruff?
That is the same thing that direct does diet will help in giving you a good hair. It will give you good, but if it is due to fungal infection, it will not help. But otherwise, slight flakiness, in case of psoriasis, diet helps a lot. Any diet which is good in antioxidants or rich in antioxidants will give you very good skin and very good hair. But if it is fungal, then it is no, I think there is no relation with that.
Okay, that's interesting. So, doctor, like when we are talking about lifestyle, people say that if you exercise, then it can help to control your dandruff. So, does exercising help in controlling dandruff?
Exercise will lead to excessive sweating, due to which you
Mhm.
uh, tend to wash your hair more frequently, and you tend to see flakiness comparatively lesser. But
Mhm.
otherwise, I think exercise doesn't have a direct role for dandruff or treating any other
Mhm.
conditions, psoriasis as well. I don't think exercise will directly lead to a decrease in the number of lesions. It will help. Otherwise, it will act as a complementary treatment, but will not only treatment which will help the condition.
Okay. That's very interesting, doctor. So, doctor, people who are more prone to have a dandruff, a dry scalp people or like oily scalp people?
Oily scalp people usually have more a tendency of having more of fungal infections due to the
Mhm.
excessive oil secretions. But I have seen that people with usually having the atopic like skin or dry scalp usually more have only just excessive flakiness over the scalp.
Okay.
Both are the people who have slight flakiness. Fungal infections are more commonly seen.
Okay, okay. That's interesting, doctor. So this discussion was very informative, doctor. Can we take some live audience question?
Yes, definitely.
Yeah. The first question is, Hi doctor, मैं भी काशीपुर से हूँ. मुझे आपका अपॉइंटमेंट लेने के लिए क्या करना पड़ेगा? और okay, this question is not related to dandruff, but yes, it's related to hair. मुझे एंड्रोजेनिक एलोपेशिया है. मैंने बहुत कुछ ट्राई किया, मिनॉक्सिडिल भी, पर कुछ काम नहीं आ रहा है. इसके लिए मुझे क्या करना पड़ेगा? कुछ ट्रीटमेंट है?
So androgenetic alopecia is due to the effect of androgens over the scalp. Usually, frontal hair, they are more prone to hair fall due to the effect of androgens. Yes, only minoxidil is not. There are also number of treatments be there. Can- For androgenetic alopecia, we can give finasteride to such patients, which is very helpful. No, finasteride doesn't even cause much of the side effects as well. Apart from that, few therapies are also available, which in case of milder cases of endogenetic alopecia, such as PRP or growth factor concentrate therapy, which is very, very helpful. And it works wonder if patient takes it for the longer period of time. It works very well. And many of the patients have seen that the reversal of almost all the hair has been there in the milder cases. And if the patient takes very well care, it is a good option which we can do for the patients.
Okay. Interesting. And for your appointment, you can always contact to KVR Hospital Kashipur and mm, mm, ask doctor's appointment. Her name is Dr. Rohini. So yeah. So another question from our audience is, Hi doctor. डॉक्टर मुझे सिपोरिक डर्मेटाइटिस है और ये ठीक नहीं हो रहा है, कुछ और तरीका है इसको ठीक करने का एंड उस मेरे को एक्ने भी हो रहे हैं, तो क्या ये इसी के वजह से है?
Yes, it can be related to the seborrheic dermatitis. If the patient is having a lot of a severe case of seborrheic dermatitis, a lot of flakes comes over to the face, and it
हुँ,
tries to clog the pores. And yes, there is increased incidence of acne in the patients having seborrheic dermatitis. So yes, there is a cure, but I have to first see uh, the problem, the level of problem. There are few
हुँ, हुँ।
antifungal shampoos work. There are some leave-on antifungal lotions which can be given for the night, which can be used twice or thrice weekly. Oral therapies can also be given for treatment, and most of the patients respond. And for the acne, according to the grade of the acne, patient has to be treated accordingly.
Okay, okay, that's interesting. Another question from our audience is, Hi doctor, मुझे किसी ने कहा पीआरपी से डैंड्रफ ठीक हो सकता है, तो क्या मैं पीआरपी करवा सकती हूँ?
हाँ, PRP can be done, but why it is not directly related to dandruff. PRP
हुँ,
has a lot of growth factors which are injected over the scalp.
okay, we have lost doctor connection, but doctor will be coming back.
Hello, Dr.
Yeah,
Muna, I'm able to you now.
it's okay, doctor. So just we were talking about PRP and also like, yeah, yeah.
I was saying that ki PRP decreases the inflammation over the scalp,
Mhm,
it decreases the inflammation around the hair shaft, it gives you good hair back.
mhm,
And due to that decrease in inflammation or anti-inflammatory properties, it decreases the shedding of the skin shedding is decreased. But
mhm.
directly, maybe it is, I don't know if it is related to hair dandruff or
Okay.
not.
So finally, doctor, would you like to give any take-home message or any other suggestion to our viewers today?
Home message, I would say that take proper care of the hair. For the proper care, you just have to do simple things: proper cleansing of the scalp twice or thrice weekly, proper conditioning of the hair. Don't try to pull your hair. Don't try to split the hair. So I have seen many people splitting the hair from the ends. Please don't try to do that. Use good towels. Use microfiber towels for scalp drying. Do not use high-end heat products for the hair because it further damages the hair. And do not use I think ammonia wala that dyes. That should not be used very frequently because it also decreases the skin health, or it lowers the skin health, lowers the scalp health. And then I think if these things are done properly, and plus diet and lifestyle is very very important. If your diet and lifestyle is good, the skin, hair and nails are good, because these are the organs least preferred by the body to be taken care of. Our body
Mhm.
usually takes good care of eyes, kidneys, heart. But if anything is happening, which is happening bad in our body, most
Mhm.
first of all, our skin and our hair are affected. So please take
Yeah.
good care of yourself as well as everything.
Thank you so much, Doctor, for sharing so much of expertise with us today and answering all the questions of our viewers. I'm sure our viewers have found the session very helpful. And thank you so much, Doctor. It was a delight to have you, and thank you so much for your valuable time.
Thank you, Dr. Mona.
And thank you, ladies and gentlemen, and all the viewers. The viewers have given the very good comments, and they have participated very actively. Thank you so much. And if our doctor have some time, another day or another week or another month, we will always like to meet again and create more awareness on hair or skincare. Until then, doctor, have a nice day and take care.
To you too. Thank you for having me here, Dr. Mona.
Thank you. Thank you, doctor. Have a nice day. Bye bye.